I have a background in pharmacology and immunology, and I worked in the pharmaceutical industry before deciding to become a physician associate. I just decided to do some research and go to the open day, and since then I haven't looked back.
My background is as a radiographer in Dr. Gray's Hospital in Elgin, where I worked in plain film conventional imaging.
I trained and did my undergraduate BSc Physiology in Aberdeen, where I also worked as an orthopaedic trauma auxiliary, and now I'm doing my postgraduate Physician Associate degree also through the University of Aberdeen.
The main thing that attracted me to the role of Physician Associate was to become more involved with patient care. This has given me an excellent opportunity to learn more about management and investigation of patient conditions and become the patient advocate that I wanted to be.
We studied alongside the medical students, attending lectures, learning about clinical medicine, and we're currently on a year worth of placements based in NHS Highland.
The potential to use the PA role in Highland is immeasurable, really, and certainly within my discipline, surgery, they've embedded themselves fantastically well in the teams and added to the value of those teams. I think they're an enhancement to our patient care, and actually there's no limit to what they could do.
Physician Associates are a new part of the workforce and are extremely new to NHS Highland. We train as generalist medical practitioners, and we can assess, diagnose and manage conditions patients might present with.
We can take histories, do examinations, clerk patients in, clinical skills like taking bloods and putting in cannulas, depending on kind of what setting you're in. We can assist in surgeries.
We can interpret blood results and chest x-rays and then come up with a management plan with consultants and other healthcare professionals.
I think because Physician Associates all come from different backgrounds, we bring an element of skill mix to the team.
I'm a believer that actually it doesn't matter where you come from in terms of a profession, whether it's nursing, medicine, paramedics, as long as you're trained appropriately, and Highland's a great place to train. PAs could actually do anything within the limit of their licence and could slot into any role, whether it's out in the community, in acute surgery, in theatres or out in the clinic.
One of the most unique things about working in NHS Highland, especially in Rigmore Hospital, is that you get to know the staff very well. We're very privileged that we work with staff across all medical and surgical specialties, and that we get to know people really well, from junior staff all the way through to senior colleagues.
I've worked with the Physician Associates for some time now. Nurse practitioners, along with Physician Associates, provide an awful lot of the healthcare in the clinical setting, and hopefully are a great help to physicians and healthcare in general and the care of patients in the wards.
We do encourage students to come up to the Highlands for a unique experience. I think a lot of people are attracted to the idea of rural practice, and you do have the opportunity to not only study and practice in Inverness, but you can also move around to different areas like Skye and Caithness, and you have the opportunity to accompany the clinicians there and experience what it's like to be in a rural setting.
For me, it was a no-brainer. I'm from the Highlands and I couldn't wait to come back, and the opportunity that arose was second to none. I couldn't wait to move back up here.
We've had a lot of support both from clinicians, nurses and the academic team here as well, so there's always opportunity to expand your clinical skills and get lots of practice. So overall the role's been really supported.
We provide a good, welcoming and supportive environment for those who may not have experienced acute healthcare in the past, and we hopefully can help them along, especially in the early formative years of their new career.
NHS Highland offers a brilliant training opportunity, not only working in one of the most beautiful places in the world, centred in Rigmore in Inverness, but also gives access to excellent training from specialist teams.